this episode, we continue our conversation with Angela Ciocia, our lead paramedic at RUMC, and lead EMT James Donnelly. Last episode, we talked with Angela and James about their careers as EMS workers, along with all the responsibilities that their positions entail on a day-to-day basis. This episode will discuss personal encounters and what it takes to work in the EMS field. So if you could please enlighten us, what does it take to work in the EMS field?
Patience.
I can imagine. Empathy.
Yes.
Mm-hmm. I guess it has to be, I don't want to say an adrenaline rush, but I guess you have to be comfortable with high stress, high level situations, I would guess.
Yeah. Especially on the drive to the call, especially if it's a priority call.
Mm-hmm. I mean, imagine there has to be times where you're walking into a situation and you're getting information. That information is accurate, and now you're walking into the unknown.
Yeah.
It's often that, I'd say easily 60% is inaccurate.
Mm-hmm.
So you never know. You may up triage, and you might believe that it's much, from what you're being told, much more severe than it is.
Mm-hmm.
And sometimes, unfortunately, it's downplayed, and you walk into something much more critical than it was originally thought.
Mm-hmm. And how do you go to a situation, and let's say there's multiple patients you could be looking at. How do you determine this person over this person?
The simple triage, first thing you do, anybody that can move, step over here and we'll get to you. And
Okay.
anybody that's able to move themselves
Mm-hmm.
is no longer a priority.
I see.
You go to deal with whoever couldn't move.
Mm-hmm.
You check for their breathing, you check for a pulse, and then you decide, are they a priority or can they wait a little bit? We have red, yellow, green. Green is anybody that can walk. Red requires immediate transportation, and yellow is in the middle. They're not ambulatory, but they don't need immediate care. Someone with a broken leg or something like that at an accident.
I see.
So you said you're both instructors.
Mm-hmm.
When you're meeting your classes, is there something that you could identify that, this person's, they got it, they nailed it, this is going to be a great addition to the team, or is there something?
Not in the classroom. Usually I can identify when I see them in the field. As part of their class, they have to do a certain number of rotations in the field. And sometimes they're with myself, and I can evaluate them right there.
That's got to be very rewarding, though, when you were doing your job out in the field and you see people you trained doing what you taught them.
Yes. I've probably trained half of the staff that are at RUMC. At one point or another.
And I probably trained
The other half, because we work for different schools.
part of the others. And it's very rewarding. There's an EMT, actually now she's a paramedic, and I'm very proud of her. I was proud of her when she was my EMT student. She was a great EMT, and now she works at a fire department, and she's a great paramedic, and I'm very, very proud of her all the time. And I tease her about that all the time.
That's awesome. That has to be a great feeling.
Yeah.
Maybe you could tell us, how important is the culture of safety as an EMS worker?
Very important, especially in recent times.
Mm-hmm.
Like I said earlier, you have to walk around with your head on a swivel and be aware of your surroundings at all times. Be aware of who's around you. Be aware of the exit.
Mm-hmm.
You always have to know where your egress, as Jimmy said, the egress is. And it's not just if you're in a house, at least you have a basic idea. If you're on the street or in a public place, you don't know what's coming at you. It may be something as simple as an accident where someone was in the wrong place at the wrong time, or there may be somebody that doesn't like EMS for whatever reason, and now you're focused on the patient, and there's other things coming in from behind you. That's why you always have to, as Jimmy said, have your head on a swivel and hope that police or there are other rescue workers there, or even civilians that are there to kind of watch your back.
Mm-hmm. So when you have that mindset of pulling up to a whatever the call may have been, when you do get the call that it's pediatric, is it a different mindset? Do you prepare yourself to it? Because now you're going into a child.
Yeah.
Mm-hmm.
We'll usually go just a little bit faster.
Mm-hmm.
Everything inpatient care-wise with pediatric, this basically the rule we teach DMT students, smaller, faster. CPR is faster on an infant than on a child. It's faster on a child than an adult. Everything you do, you have to be much quicker.
And I imagine there's another element to that with the family. You have a child, the family is probably...
We have to focus on the patient, and calming the parents or family members comes second. We will try if we can, but we're focused on the patient.
Of course.
Yeah. So with an opioid epidemic across the country, especially in Staten Island, are you seeing many overdose or opioid-related cases, and how do you care for these patients?
Yes. They recently, well, not recently, 2 years, 3 years, they gave us Narcan. They gave the BLS units Narcan to revive opiate overdoses. Is a lot more prevalent, and we're seeing now in the last year different drug combinations that are resistant to Narcan. They're taking such high doses of fentanyl and other stuff mixed with the opiates that the Narcan won't even touch it.
Wow. And what do you do in a case like that?
We keep them breathing and we transport.
Okay.
And as Jim said, like they added the Narcan to the EMTs, they've also added it for civilians, for fire department, firefighters, and for the police. So they're the first leg. But I mean, the fire department, the police officers may give it the Narcan already. And if my EMTs get there, they may have to give a little bit more. And then I have protocols that I can give. But as Jim said, because of the mixing of drugs, sometimes all we can do is either ventilate them, intubate them, which is the tube down the airway, and keep them breathing and get them to the hospital because they may need something more than the EMTs or the paramedics can provide.
And I imagine in those situations, you're also in some ways having to do like fact finding, like what did they take? What did that?
A lot of EMS's detective work is interviewing your patient to try to get the proper real answers. Because sometimes what they're telling you is not. They'll swear up and down they didn't take any. They'll wake up to the Narcan and they'll swear up and down I didn't take anything. But there's only one thing Narcan works on. So if Narcan woke you up, then we kind of know what you did.
Is that how it happens? It triggers it instantly?
Narcan reverses opiate
It blocks the receptors of the opiate,
a minute or two with the nasal,
and it also
within seconds with the IV.
So it also depends, like Jim said, with the intranasal Narcan, if the patient's been doing snorting the drugs, it sometimes changes how quickly it'll work, unfortunately. So it works a little slower because those receptor sites are a little deteriorated from years of...
But Narcan has no side effect, and that's why they gave it to civilians and police to administer, because they realize you can't hurt somebody with it. And there's only one thing it'll react to. So if you suddenly wake up after you were given Narcan, you had to be on something. You can tell us no all you want. We know you're on something.
And the only slight caveat to that is, as Jim said, it won't hurt anybody. But unfortunately, if I give Narcan to someone who needs it, by all means, that respiratory compromise, they need it, I potentially can send them into withdrawal. So if it's a chronic opioid user or someone who's very sick, there are patients that accidentally overdose, whether they have cancer or medical problems, that they are on some sort of opioid. If I give them Narcan because they can't breathe, I'll help them to breathe, but I'll also take away their pain tolerant, their pain treatment. So I may send them into withdrawal. So that's another thing you have to be cautious of.
So you say that a lot of it is detective work. So maybe like a bit of a PSA here. To make your jobs easier, it would be very helpful and probably important for people to have their information when they come in to let you know what conditions they have, what medications they're taking.
We can usually tell what conditions they have from the medications. If they even just carry a list of medications, we can figure it out from there. Because we've seen all the medications so many times, we know what they're for. And if you happen to get one that you don't use your phone, Google it, and it'll pop up. What it's for.
I tell family members and friends with, I can't say elderly, anybody, if you're on insulin or you have medical problems, whether it be cardiac history, diabetes, cancer, if you put a note on your refrigerator, because if you're unconscious, I'm going to check your refrigerator for insulin. And while the note's there that says, oh, well, Alex is on X, Y, or Z, I have an idea of what could be the problem. Not absolutely what's the problem, but could be the problem.
Right.
Whether it be diabetes or drugs or
Well, that's the thing. You could be walking into a house and the only applicant called 911 before they passed out. Now you have no one to tell you what's going on.
and that unfortunately does happen. That there is no family member, there is no friend there that the patient called and then became more in distress
The opiate overdoses are almost always found alone.
No, really.
because their friends all leave.
They're not going to do it when someone else is around. So people find them in the bathroom. People find them wherever.
Mm.
And are you seeing younger people with these? Yeah.
In my opinion, there is no age gap. I'm seeing everybody from young, junior high school age, to older than and should know better.
Wow.
So scary.
It is. It is frightening. It is frightening.
And unfortunately, I shouldn't laugh. It's unfortunately, and it's sometimes it gets to be a family affair. The daughter and the father, or the son and the aunt, and they share. So now I have two unconscious.
Right. And I'm imagining with these overdoses, there are times where I'll say a familiar address comes up over and over again.
And when they are conscious, how do you deal with somebody who's out of control when you're trying to assess them?
It depends on how out of control. Sometimes we can calm them, and sometimes we have to get the police involved. And if it's a question of our safety, then we're going to involve the police.
Yeah.
Sometimes, a lot of times, public, especially in the areas we cover, this anti-police mood, and they're like, "Well, we called for the ambulance. We don't want the police." I'm like, "It's a package deal.
Right.
You get both of us or neither. So we're not coming in without the police."
And that's an important point. I mean, you guys are first responders like the FDNY, NYPD, and, in the last couple of years, the respect that you guys should always have had has increased as we all went through the COVID pandemic. I can't think of being on the front lines any more than you guys during that pandemic. Can you tell us what that was like the first month or so when there was really an element of the unknown that you were dealing with and you're going to these houses, and how did that change as the pandemic progressed?
It was scary. We didn't know how to protect ourselves, even aside from wearing masks and gloves, and how far was that going to get us? People were still getting COVID, even though they were masked up and gloved up, and people that we knew were doing everything by the book were still getting COVID. And it was just take what precautions you could, and you got to do your job.
And it got difficult in the fact that as time progressed and we got more personal protective equipment, our equipment didn't get any lighter, though. So to go up 2 flights of stairs with our gear, I was out of breath with 2 masks on and all my gear and a gown on before I even got up to the patient.
Right.
And if the patient was critical, then you have to work twice as hard because you're overheated
Right.
overheated as it is, and you have to work quickly and safely. I mean, sometimes safety you kind of forget, but now you had to be extra cautious, and it was a lot.
Did you get the sense that something was? I mean, because you're seeing people right away in their homes with these same symptoms. Did you start to get the feel that this was something out of the norm? That so many people were having the same type of symptoms,
We knew what it was before we started getting to the increase in patient load. That was all public knowledge.
Right.
This was going on in China. It was going to come here.
Right.
And it blew up in April of 2020. The call volume went through the roof.
Right.
We went from doing on the 5 boroughs doing about 4,000 calls a day to over 7,000, 8,000 calls a day.
Wow.
And the biggest trigger with us, the fastest way we could tell was we put the portable pulse ox on someone, and we tell from the pulse ox if it's in the 80s, it's COVID.
Wow.
And because COVID affects the respiratory.
You're supposed to be around, like 95?
About 95 to 99.
And
Smoker, maybe in the low 90s.
as you said, COVID had affected everyone. We all know, everyone knows someone that was affected, and a lot of them, I mean, some of our coworkers were very, very, very sick. Some of our coworkers, thank goodness, not had passed.
Right.
And they were doing everything right.
Mm-hmm.
It just, they still got sick.
Right. And how did you put yourselves in that mindset of you're dealing with something that could potentially be deadly, but you have to go out and do it?
Yeah.
How do you
Put it out of your mind as much as you can.
Mm-hmm.
I don't know anything else. I had to go to work.
Right.
I warned my mother-in-law, who had respiratory problems, for instance, she was in her 80s. Please be careful, please be careful, please be careful. And I can close my eyes and recall the phone call from my nephew that grandma's sick. I don't know, can you go there? And I went there thinking my mother-in-law had been safe and been home. And she was transported to the hospital. They said, nope, it's not the flu. She's got COVID. And that was in March of 2020.
Mm-hmm.
And she passed on April 1st of 2020.
I'm so sorry.
I still had to go to work.
Right.
But you do the best you can and hope I stay safe. I keep everybody I know, my family safe.
Mm-hmm.
That's the best you could do, is do your best.
Right. And then as the pandemic progressed, you both worked in the vaccination center at RUMC, correct?
No.
Ange did. Ange actually vaccinated me. So,
And one of your daughters.
and one of my daughters. But Ange and her colleagues, when RUMC opened its vaccination center, and I believe Dan and his family were vaccinated as well. The center just recently closed in February, but we administered over 43,000 doses of the vaccine, which is no small feat. To do that because of the time length between doses and everything else that went with it. What was that experience like? You're going from responding to COVID patients, and obviously you still were, but now there's kind of this light at the end of there's this vaccine, everyone's coming to get it, and now you're giving out the vaccine. That's kind of like parallel, like a yin and yang almost.
It was good. What made me feel good, that I could try to help people. It was disheartening how many people came because they had to, because they were mandated to, because I was there trying to help.
Mm-hmm.
And for them to be mad at me because I'm giving them the vaccine, sorry, I didn't come to your house. You came to me. I'm just doing what I was told. I'm trying to help you.
Mm-hmm.
And some people didn't see it that way.
Mm-hmm. How has any of the protocols or procedures that you guys follow now changed as a result of the pandemic?
Not particularly.
I think we're more careful residually now.
Right. So it's not like an official change, but you
Right.
guys have learned things.
Cleaning our equipment, being a little more cautious.
Mm-hmm.
Because, I mean, for that time, we were cleaning our vehicle. I mean, we clean our equipment often, especially when we see something that we know is a problem.
Mm-hmm.
During COVID, we were cleaning our equipment and our dashboards and ourselves chronically because we didn't know what could possibly be the vector.
Well, being that you guys have so many years of experience in the field, I would love to hear some of your most memorable experiences on the front lines.
Well, we got called for a snake bite on Bay Street. We figured, was it a garter snake?
Yeah.
What could it possibly be? We pull up to the house, and the guy comes running out of the house, and that's always a bad sign when they're coming running, and he's screaming, hurry up, it swallowed my son's arm, and it won't let go.
Oh my God.
And we're like, oh, okay. We go in, and he had a boa constrictor that he just bought, and it was his first attempt at feeding it, and it swallowed his hand.
Oh my goodness.
It couldn't get past his thumb. And it was coiled all the way around his arm, and we're like, didn't cover this in EMT school.
No. Well,
So-
what did you do?
So my brother is a zookeeper, and growing up,
How ironic is that?
he had every pet you could imagine. So I had some knowledge that, okay, I know snakes don't like cold. So we got every cold pack out of the truck, and we popped them all and put them around the snake, and cold puts the snake into hibernation.
Really?
And as soon as he was hibernated, we unwrapped him.
Did you ever think you were going to need to use that information?
Well, that saved you from a very...
You talk about karma, huh?
Wow. And he was so thankful that we didn't have to kill it, because he could take it back and get his money back.
Don't think you'd want to keep a pet after that.
I mean, of all
Wow.
I want to go get a refund.
Here's why.
And was his hand okay?
Yeah,
after
a
that?
few puncture marks here and there.
Wow.
Took a little stretching to get the circulation back.
I can imagine.
No, I can't top that.
Certainly a unique call.
No, sorry, can't top that.
But you really got to be ready for everything. I mean,
Well, everybody in New York EMS knows the story of Ming the Tiger. It wasn't our job, but
No.
it was Harlem.
that's right.
Okay.
A tiger?
There was tiger in your park.
There's a tiger. in
Guy,
the car.
guy calls 911 because he says he got bit by a dog. And the ambulance gets there and they look at his leg and they're like, yeah, that wasn't a dog. So they call the police and the police walk upstairs and the police walk into a 450-pound Bengal tiger named Ming.
Yes.
So you can Google him and they have pictures.
Wow.
Looking out the window. Indeed. Unfortunately, or fortunately, Staten Island is a borough of plenty of animals and plenty of people.
This is New York and
There's no such thing as surprise.
Yeah.
Yeah. You never know what you're walking into, whether it be someone who collects exotic animals like snakes. We had a fire and the firefighters went up and there was tucker toads or big totems. And there was about 50 exotic snakes. And thank goodness firefighters wear boots
Yeah.
Wow.
because then the
they're
fire,
loose.
they were loose.
That's scary.
Because with the fire, everything got knocked down and
Yeah.
the fire was out, but then they needed people to come from the zoology because of the snakes.
Wow.
Wow.
Yeah.
I mean, you said about safety and animals, we'll go into that. I mean, now it's not as bad, but in the late 80s, early 90s, unfortunately, because of the areas we work in, there were still dog fights, cockfights. And the loser of the pit bull fight that had been on the roof sometime got thrown off if he wasn't dead. And you'd hear this bizarre sound of whining, and it comes closer and closer, and then you'd see a dog drop. And they would throw things at us on the roof, and sometime it was the dog that lost the fight.
Oh.
Thanks. Do you ever deal with dogs at houses when you go to rescue somebody?
Yes.
A dog just being protective of their owner, and that's another element.
Dogs have teeth.
Yeah,
I don't care how
They
good,
don't recognize the patches.
and they don't care.
of course.
I have been nipped by small dogs trying to take care of their family members. I have large dogs, so I'm not really afraid of dogs normally.
Yeah.
But on a scene, I don't want them all put away.
What would your most memorable story be?
Talk that.
Goodness, I can't top Jim. I don't know. I've had, unfortunately, lots and lots of bizarre jobs.
Yeah.
But my most memorable job, goodness. Well, we mentioned about when my coworker or any of my people that I know get injured. That's always memorable. Then stuff that never. I can close my eyes and go back to jobs in 1981. The really bad ones that I can remember. This
Some of them never leave you.
who was there, the EMS, the location, what the cars look like, what this house looked like, and it's there.
Have you ever had a situation where someone walks up to you and it's like, you saved my life?
They all recognize me.
Yeah.
I am very bad with faces. I know addresses. I know street layouts. I can tell you where an individual house is because I usually drive the truck. I awful with faces and names, and they'll all recognize me. There's not many 6'4" Irishmen.
Except sometimes you walk.
I get confused with her husband. Yeah,
Before he had a beard.
But that's gotta be very. I mean, someone walks up to you and says, you may not know my name, but you saved my life.
That's one. Now that you mention it, I had a patient. I was a brand new medic, and the gentleman was very, 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 very sick. He did overdose, and I and my female partner took care of him. I don't remember his face at all, but I remember the tattoos. 2 years ago, I was in 7-Eleven buying a cup of coffee, and this kid says, "Oh, I'll buy her coffee," and I'm like, "No, thank you." And he said, "You saved my life, and you changed my life." And I was like, "Okay, you don't remember me?" And I said, "No, I'm sorry." And he unbuttoned his shirt and showed me his tattoo because I had mentioned I made a comment about his tattoo. And I did. And the kid, at least the gentleman, I should say, says that he's never done drugs since that day.
Wow.
And he's now a drug counselor.
That's fantastic. Wow.
So that's a win.
Of course.
I don't have
Great
many.
story.
I don't remember many wins. I remember most of the losses, but that's one win.
That's definitely a win. And I'm assuming neither one of you have had to deliver a baby.
Yes.
You did?
Oh, yeah.
Oh, wow.
Anybody who does this job is going to deliver one eventually.
How many?
One, I drive really fast. So most of the time they get here
make it.
before they deliver.
But this particular
This
time,
particular one, she was already, baby was coming out before we walked in the door.
boy or girl?
Girl.
Wow.
I've assisted in 29.
Wow.
She doesn't drive as fast.
I say assisted. Moms deliver babies.
Yeah.
Doctors, nurses, we just help.
Mm-hmm.
And I've assisted in 29.
Wow.
Some wins. Again, we go back to some are wins and some are losses.
Wow. 29 is amazing.
So you really
Alex, it's 41 years that I'm on the truck. It happens.
That's true. That's true, I guess.
That's incredible. So I'd love to know, how do you pass the time between calls? Because I'd imagine there are some
Kindle.
slow days. Kindle, huh?
Kindle.
What do you eat? You know, where do you station yourselves? What's it like?
Well, as we said before, we are stationed where the fire department tells us.
Okay.
So we're on street corners.
Okay.
I knit.
Okay.
I read. I try to pass the time playing on video games.
Yeah. Any favorite foods to keep you up or going?
McDonald's.
I unfortunately work nights, and unfortunately, many of the places close down.
Right.
So if I'm not bringing it with me, I'm not having it.
Yeah.
So, I try to stay somewhat healthy. Try. I drink coffee. I have more coffee in my veins than blood. I've always been a black coffee girl myself, so I drink plenty of coffee.
Yeah.
But, I try to stay healthy because the food's salty snacks just makes you tired. It makes you feel, So
I
we
can
try.
understand that. So in our final minutes together, if you could talk to us a little bit about your colleagues who are ready to serve Staten Island community 24/7.
You said, James, and I've been doing this a long time.
Yeah.
You have to like what you do. You have to try to be compassionate and empathetic with our community. Our coworkers as a whole, we try hard. We try to do what's best for our community and for each other. We try to watch each other's back because we have to. As I said, if we don't watch out, it's a loss.
Yeah.
And I myself, I try to do self-care. As you said about debriefing, I just took a critical stress debriefing class. I try to read things to be proactive
Okay.
and try to help me and my coworkers.
And what do you like to do to decompress and de-stress?
I build ship models. That's my getaway from the job.
Nice.
How many models do you have?
Hundreds.
Wow. How big's your house?
Fair bit.
Do you have any inside the glass, bottles?
No, I think they're in a glass case. I don't build inside the bottle.
Yeah.
Wow.
Very cool. That's very cool. Well, I'd like to thank you, Angela and James, for joining us today and for all that you do to keep our community safe and for your continued dedication over the years. It's really impressive. And
You guys are really two of the most humble and selfless people which I've ever met. So thank you.
Absolutely. Thank you. And if you'd like to learn more about our services that are provided at Richmond University Medical Center, you can visit our website at www.rumcsi.org. You can also find all of our podcasts there where you can like, subscribe, and share our shows, as well as all streaming platforms. And if you'd like to donate to RUMC and support people like James and Angela, you can go to our website and click the donate button, and it's found on our homepage. And that about does it for this episode of RUMC Connections. Thanks for joining us. I'm Meredith Gaskins.